Welcome to Dependency TV.
Reality TV at its best.
Where every life is a biography.
I am Garth Sinclair.
And I'm Natasha Nunez. Today on Dependency, we explore the topic of sexual and reproductive health. We speak with a man who is HIV positive for a number of years, but is living well with treatment.
We also speak with an expert from the Ministry of Health about the prevalence of sexually transmitted infections, the urgent need for testing, and living with an STI.
I found out from when my deceased wife was on a dying bed, and the doctor just came and told her, well, you have AIDS. And I immediately got tested, and it showed up there, but not as much as her. And I supported her until death. And after that, I just blanked it out of my mind. And then in 2012, it was confirmed that I had AIDS. And it wasn't easy at all because I got remarried and had a child, and it wasn't easy at all because I couldn't have walk as a pampers, and the doctor said he was going to die. So it was very difficult. Apparently, she did live a promiscuous life, and before having sex, I didn't know anything about HIV, and we had unprotected sex. So unfortunately, being married, I contracted the virus from my deceased wife. That's of course, and that's hampered my ability to walk and being in pampers. And actually my CD4, my immune system was 63, and normal person is 1500. So when we got tested, my wife was there when I got tested, my cousin's wife, and she said she felt relieved because we were going to doctors and doctors and doctors, spending money, and she just felt relieved. Probably what people were saying about me and her, and with my workplace. So we just decided, hey, let's do the test and get it over with. I was hoping that it's a dream, it's a nightmare, It felt like a whole truckload just came down on me. My wife was expecting it because she was doing some researches and whatnot, and she expected it. She got tested and she's negative, still negative. Well, after that, I was sent to a home, HIV home, and we started to develop she developed a kind of wall, like separation wall, but eventually we overcame it, and we have our second child. Firstly, before you have sex, unprotected sex, you should at least get tested. Both partners should get tested, and educate yourself about certain STIs and STDs because it's not only HIV out there, So education is the key.
The role of PAHO WHO in general, our mandate is to work with countries to improve the life and the quality of health for people in the region of the Americas. And as the arm of the WHO in the region of the Americas, we stand behind that mantra of leaving no one behind. A major role that PAHO plays generally is being that catalyst. Sometimes you just need an organization there to kind of push things, and sometimes PAHO is that catalyst. We facilitate, we encourage, we advocate, we bring stakeholders together.
No, it's not. I live normal. I tell people I'm HIV, but I'm HIV positive and I'm HIV, and they think I lie. They ask for the proof. I said, but wouldn't say there's a difference, because first thing when you say I'm HIV positive, they say, well, you look for that or you're a bad man, you're a player. Or if you're a woman, you went outside, is a whoever is a thing. But it's similarity, because even in my clinic, when I do counseling in my clinic, the greater women that come inside there, guys will be like, you're hot. I taking you for wherever you have. And they will be HIV positive, but our guy will be like, it's the way you carry about yourself. It's sex. It's okay. People go on the looks. People don't go on facts, but they go on looks. Because right now, I plenty women running me down. I hope my wife can hear that. Plenty women running me down, and I will say I'm HIV positive, and they will love me more. They respect me more because I'm being open about it, I'm being honest about it, and very few men or very few women will do that. And that should be our law in Trinidad because it comes like murder. In America and these places, there's a law, but I haven't heard anybody with that case as yet. And why I say as yet is because things happening in the HIV scope, in the HIV realm, things are happening and things are changing. So hopefully that becomes a law. Medication, thank God, is free. It's available to the people that are infected. So what they are doing now is test and treat. So once they get tested HIV positive, regardless of where your immune system is, they start the treatment one time, so you live longer, you live a better life. Tablets, medication, and some people lapse from taking medication because when they say when they pick up the medication, they remember why they have to take it, and it's a kind of deterrent for them. Must stick to the routine until they die, which I ain't going to die now. Yes, I recommend education in school, sexual education in school, because they see in it from children are sponges. They have this, what they see is what they do. And some parents, the kind of shows they're watching, the kind of music that they're listening to, and I mean we're sharing that. Carnival, Easter, great race. So these things have an effect on the children. So when they see something, they will experiment. And also in the secondary schools, it's because I want to have sex, but we're not thinking about the aftermath. And when you say sex education, it's not about prevention, about pregnancy. It's holistically HIV, STIs, STDs. I am part of that, where we do counseling and treatments for HIV and AIDS. I am the person that walks with an individual to the clinic. So you look for a peer support counselor. You don't want to tell the whole of Trinidad and tell you, hey, I'm HIV positive, because the effect of that will be dramatic, but there is clinics, all clinics supposed to be doing HIV testing and counseling. So you just seek that information and you go. It's not about how you look, but it's about what's inside of you, So I look good, I am living with HIV. I don't say how long I'm living with HIV, but I know it's about 16 years. And know your status before you have sex. Know the person's status before you have sexual intercourse. And a little pointer, we was hiding it from our daughter for a while. And when she turned 11, we told her, and she said, I know. And it's my daddy, I love him still. And now she's an advocate for HIV. My daughter said she knew. Because that's what I'm saying. Children are exposed to certain things. They do research on the tablet, on the phone, on the computer, and they see stuff.
There are certain truths in life. That nothing lasts forever. And no matter how challenging things seem now, it will all pass. That the world is full of endless possibilities, and all of life is precious. But we are all connected on this beautiful earth we share together. And everyone needs someone to be there for us when it matters most. No matter who we are or where we're from, one way, one world. Live easy with Guardian Group.
I'm a part of is an integral part of the Ministry of Health, and in the lives of those living in Trinidad and Tobago. Our work and mission is to prevent the spread of HIV and AIDS, treat, support, and care for those living with HIV and AIDS and those affected by HIV and AIDS. We don't work in a silo. The national HIV response is truly national. It is something that we work with all ministries on in terms of serving the population. I will say that over the years, Trinidad has been successful in seeing a decline of cases, and the hope is that we continue to see that decline. Prevention, and I think people said it on numerous occasions, as it relates to health, prevention is key. And it's an ongoing cause, it's an ongoing public health concern. And so although globally we're seeing a decline, globally we're seeing things change, we also recognize that there's still a need to continue the work that we do, continue the work in mass communication, and continue teaching people about this public health concern. So currently, we estimate that there are about 11,000 people living with HIV. And of course, we're always looking to see what's changing, if anything is changing, and how best to continue to address this issue. I think it's important to understand that it is preventable, right? I think for decades, we've been talking about abstinence. We've been talking about 100% condom use. We've been talking about being faithful to a partner and knowing your partner's status. Those things haven't changed. What I do think we need to address is, of course, the stigma and discrimination around HIV and AIDS. And of course, now we live in a century, in a world where drugs and treatment are working, and we see persons being able to live long, fruitful, productive lives with HIV, being able to have families, being able to have children. And so being able to balance the prevention message of use condoms if you're sexually active, be faithful to a partner, know your partner's status, know your status. And of course, if you're exposed to HIV, to be on treatment, adhere to treatment so that we eliminate the spread. Because although you're positive, you can't stop the spread of HIV if you adhere to your medications. Yes, so we would call that a serodiscordant couple. So like you mentioned, one person's positive or is living with HIV and another person does not. And so if that person is adhering to medication, we can suppress the virus to the point where transmission is very, very low. And of course, we're always going to encourage condom use. We're always going to encourage a close relationship between your healthcare practitioner and the couple. Because it's always going to be best to recognize when you need to talk to your healthcare practitioner and beginning to open that type of relationship between the two of you. So that person can personally counsel you on what that relationship may need.
Agricola Credit Union Cooperative Society Limited introduces its new and improved mortgage loan package from as low as 5% per annum. Home renovation, purchasing a home, constructing a home. Come to your credit union today. Speak to our friendly and courteous staff. See your dreams come true. All lending criteria apply. Check us at our head office, 20 Phillips Street, Port of Spain. Arima branch office, Pro Queen Street, Arima. Tobago office, Plymouth Road, Scarborough, Tobago. And our Marabella office, Pamela's Mall, Marabella. Agricola Credit Union, your very own, working for you. Some of us like to play games of chance, but remember, gaming should be fun, so don't get carried away. Play for a prize, but don't pay the price. Play for fun, but never for keeps. Play smart, but never play all. Winning isn't everything. If you or someone you know needs help, call our gambling addiction hotlines. Rebirth House 24-hour hotline 466-3146 or Serenity Place Empowerment Center for Women 648-5401. An initiative of NLCB and Eye on Dependency.
In Trinidad and Tobago, we are on a mission to eliminate mother-to-child transmission. So what that means is we don't want any woman living with HIV to pass the virus on to their child, because it doesn't have to happen. We can eliminate that transmission. And so we encourage all mothers who are pregnant to be tested so that you know your status as early as possible during your pregnancy. And if you are tested positive for HIV, that you are put on the correct medication so that you don't transmit the virus to the baby. And so we have quite a few things in place to ensure that that doesn't happen. The country provides free milk for formula for mothers who are positive, so that that's not an added expense to the mother, because we don't encourage breastfeeding currently in the country for mothers who are positive. But because we don't encourage that, we want to make sure that we're not adding a burden to those mothers. And so we're providing that nutritional replacement for free. I do. I do think things have changed. I think conversations like this are always helpful. We see young people especially taking the charge with advocacy. We see persons who are living with HIV are able to share that publicly and talk about their story and talk about their experience. However, I think the damage that was caused years ago when we first started addressing HIV globally, there was a lot of fear around it because it was unknown, it was something new. And I think a lot of that, a lot of people struggle with and have held on to. So conversations like this about the fact that it is preventable, it isn't something that is only in one particular population. Everyone is impacted or affected by HIV in some way. I think we live in a world now where everyone can say, you know, I know someone, or I know of someone that has lived with HIV, or loved someone who has HIV. And I think that has helped us being a lot more open. But I do think there is real stigma and real discrimination. And that is something that impacts how many people come forward. And so we want to ensure that we eliminate stigma and discrimination. And that's going to be a cultural shift, right? That doesn't happen immediately. But once we start to recognize that this can happen to anyone, that it is something that is treatable, something that you can live with and have a full life with, I think it's going to open the door to people coming forward. And we want people to come forward. We want people to come get tested. We want them to seek treatment. We want them to bring their partners in. And we want HIV testing and treatment to be the norm, right? I go every year, I get a pap smear. Same thing should be happening for HIV testing if you're sexually active, right? I'm over 40, I am getting a mammogram or doing certain things, or checking for testicular cancer. It should be in the same line of healthcare, because it's just something you should care just as much about as anything else. Yes, I think anything is related to HIV and AIDS, right? Because it is something that can be transmitted sexually, can be transmitted via needle sharing, any sharing of blood. Like we mentioned, mother-to-child transmission. So it can impact anyone, including drug users. And so while our unit is not specifically geared towards a particular population, we work as much as we can with different key populations. So we consider key populations persons who may be most vulnerable to HIV and AIDS, and that includes our drug users. And so one of those reasons is because drug users are struggling, right? Maybe struggling with an addiction or maybe struggling with substance misuse. And so they may make some decisions that they may not make if they were not struggling with substance use. I may use a condom if I'm not intoxicated, right? But if I am intoxicated, I may not be thinking about condom use, right? Or be thinking about going for a checkup and getting tested. And so those are some of the reasons why someone may be more vulnerable if they're struggling with substance use. And of course, there is real stigma for persons who are struggling with substance use and misuse. So if I recognize that I'm struggling in that area, I may not come to your health center because I may feel, that I need to stay away, or I may not go in for a checkup with my private doctor because I may not feel welcome. So these are social reasons, as well as the disease of addiction are some of the reasons that make persons more vulnerable. And so we recognize that we need to reach drug users and those struggling with drug use to encourage them to get tested, to encourage them that this is also part of your health and that we're here to support you in that way as well. I believe we need to start educating our young persons and our children as early as possible. And of course, using relevant information and age-appropriate information, right? So as soon as your baby is born, you begin to teach them about their body parts, right? And as they get older as a parent, you begin to maybe be more detailed about what's happening and more detailed about things that you want them to learn. And so I believe it is the job of parents, the job of the community, the job of our country to begin to teach our children at a young age and appropriately what they should know and what should be happening, because what we recognize is that persons are exposed to information a lot sooner than maybe we used to be. There's a lot more detailed information out there. A child can't just, hop on the internet and find out something that they want to find out. And sometimes they find out information they may not be ready to find out or learn or understand. And so I think it really is up to us to begin talking about their health in its entirety, right? So yes, you're eating your vegetables, but what are some other things you need to teach your child too about their holistic health and really caring for themselves holistically? Well, anyone living in Trinidad and Tobago within our borders can access free HIV testing and treatment. So our testing sites are located all around the country, in every part of the country, and our treatment sites are located in each of our regional health authorities. And so people can access care there. They can ask questions there. I think our nurses are very open to answering questions. We know that some of our nurses do education within the health clinics. And so we encourage everyone to access education, testing, and treatment wherever they live. We recognize that we're in a time where it can be treated as a chronic disease, right? I'm living with diabetes. I have to be on medication. I have to be taking care of myself. And so we want persons to acknowledge that, yes, one, it is preventable, right? By using all the other the options I talked about earlier. But also that if you are living with HIV or someone you love is living with HIV, that they're still the person you love, and there's an opportunity for full and long and fruitful and productive living.
Having an STI does not mean the end of your sex life, but we must all protect ourselves and be aware of the many ways STIs are spread. Not allowing attitudes towards sex to stop you from being informed.
Join us next time on another informative edition of Iron Dependency TV. The topic, non-communicable diseases, NCDs. See you then.
on Dependency, reality radio at its best, every Sunday from 6:15 to 8 p.m. on I-95.5 FM. Don't miss it.